As chairman of the board of the hospital, we were going through a time of transition. Once we kind of got things straightened out, we had to move towards philanthropy. There was nobody within the community that was better respected than Jack X. And he was a logical person to go out and to try to foster the relationships that he had built over a long period of time to really support the needs of the hospital and our community.
The relationship with Howard Shaw is really quite unique. So one of these days he was sitting in the office and telling me he wasn't feeling well, but he said, well, can we do something for these cancer patients? I said, well, gee, to start a cancer, it's going to be pretty expensive. He said, how much would it cost? I said, it's going to be about $17 or $18 million. And I was just shuddering, just bringing something that large. He looks up, he says, Jack, I think we're going to do it. I didn't know what to say. I stuttered, I stammered, because I'd never really asked people for money before. And the rest is history.
As the Cancer Center was growing, it became aware to us on the board that there were people sleeping in cars, and there were people coming from remote communities that just did not have the resources to be able to deal with this dreadful disease. That was the genesis of Jack's Place.
Dr. Hardenberg was a tremendous partner. We and this group formed, this small group.
Susie got 6 of us together and said, let's meet for lunch once a week.
Ann Smead always says that's the most expensive lunch she's ever had.
And we would, and Patty would come talk about what was happening at the Shaw. We'll never forget the time when she came and said, there's a man who's going to sleep in his car for his 8 weeks of radiation treatment. And
it was February.
It was cold.
Yeah,
and
so that's when we knew that the housing had to be a priority.
Yeah.
What these folks did, these wonderful women, they decided they're going to look around the country and get some ideas. Mm-hmm. And on their own nickel, they traveled all around the country looking what they wanted to do, have a place for people to stay. They could, do their own kitchen stuff. They would be close in, and they would be healing at a certain level.
We sent out a letter to, I can't remember how many people, a group of people, but we knew everyone. We didn't make any follow-up calls, and we raised $180,000. And we all said, well, if we can do that without any follow-up, maybe we ought to shoot a little higher. And that's when the house was actually the germ of an idea and then reality.
Jack was right there. Jack was on board, and he was the presence that gave us the advice as to what we needed, how we could go about it. We did it in, I think it was 12 months, from start to finish, money raised, and 12 rooms built.
Everyone decided they're going to have a big celebration, so we went out to the Donahue's house that night. There's a picture of everyone going up these big wide staircases they had. It was just packed full of people. So someone said, oh, you hold this banner, you hold this, and the banner was between. I said, Jack, come over here, and why don't you hold this in and someone hold that? I said, fine, I'm looking here. And as everyone starts looking around, all of a sudden they turn and look at me. No one said a word. So I said, Jack, what does it say on the front of that banner? I looked, and it said Jack's Place. And I about died. I had no idea.
Jack has been an inspiration for so many to get involved in the community and to stay involved in the community. And Jack has obviously done so much to create the healthcare system that exists in our community. With his initial involvement with Vail Biomedical Center and Vail Health now and the Vail Health Foundation, he has truly transformed the way we have access to and receive care in our community.
He's a good guy that you don't mind giving money to because you know it's going to be well spent.
I mean, one of the great things about philanthropy with Vail Health is that you can see the tangible results. You can see the programs coming alive. You can see the building coming alive. And it's so rewarding in a community that you call home.
I really enjoy still being involved and being part of the involvement. I enjoy educating folks in other communities about what we have here and our accomplishments and what we built here over the years, because I'm really proud of what's just going on here.
Many of you know Jack is a kind and compassionate physician. But what people don't realize, and probably Jack didn't realize when he went to medical school, He's also an accomplished fundraiser. Over his career, Jack has helped raise a tremendous amount of money to benefit Vail Health. A number of years ago, the hospital was going to be remodeling hospital rooms. This was before the master facility plan expansion that we've just completed. Jack was working at the foundation, and he and the team there started a mini campaign to raise money for this remodel project. In exchange for a generous gift, benefactors would be allowed to put their name on a hospital room. One of the things that's made this room naming campaign successful is that people enjoy seeing the names of people they recognize or have heard stories about when they come to the hospital to visit loved ones. We've even had people ask if they could stay in their room when they come for a scheduled surgery. As the Vail Health Foundation staff thought about how to recognize Dr. Jack Eck in his retirement, we realized there was one very important name missing from the hospital room naming project. We reached out to many of you to help us with that, and we weren't surprised at all by the overwhelming response. Jack, we couldn't think of a better way to honor you than putting a plaque with your name on it here in the hospital, on the patient care floor where you've taken care of countless patients and families. We couldn't be more proud of the work that you've done on behalf of Vail Health over your career. Thank you, Jack.